Good afternoon. I'm so pleased to have the opportunity to share what families with rare conditions have taught me about the importance of having a genetic diagnosis with you today. So, as mentioned, I'm a genetic counselor. I work at the National Human Genome Research Institute at the National Institutes of Health, and I've had the pleasure and privilege of working with families with rare diseases for close to 15 years. And so there's an extensive literature about the Diagnostic Odyssey. It's a well-known term. And so even though that exists, my approach here is really to kind of focus more on my experiences in working with families who are touched by rare disease rather than to kind of summarize the academic literature that's available on this topic. Our group at the NIH studies stunningly rare disorders. One of these I'm certain you've never heard of. It's called Proteus syndrome, but you've probably heard of the most famous person who's thought to have had this condition, the Elephant Man. He lived in Victorian England. So this disorder is officially quoted with an incidence of about 1 in 10 million, but I actually think it's probably more rare than that, probably more on the lines of 1 in 100 million, 10 million or 100 million. And families with this and other rare overgrowth conditions come to our research study at the NIH, and what they do when they come is they hope that participation in our study will represent an end to an incredibly long and challenging process that's characterized by uncertainty, innumerable visits to specialists, labels to describe their child's condition kind of piling up in the chart, and none of them ever seem to go away, and a litany of unanswered questions. An experienced clinician who's seen lots of patients with these conditions can make an accurate diagnosis with a physical exam and review of medical history. But the problem is that these conditions are so rare that most genetic specialists will go their entire careers without ever seeing a patient with one of these conditions. Thankfully, genetic testing has recently become available for this set of disorders. And while a skin rather than a blood sample is needed in order to perform an accurate test, these tests are not technically difficult to perform. But I'm continually surprised by the number of referrals we receive from families and whose clinicians have not been able to get these tests approved because of insurance concerns. In addition to helping solve potential diagnostic confusion and give patients and families the answers that they're looking for, promising drug treatments are currently being developed to address these conditions, and they're tailored to the specific genetic changes that the patients have. If these treatments work the way that we all hope that they will, it could mean that children with these disorders can get their treatment through a simple pill instead of a series of invasive surgeries all throughout childhood. So while this would obviously mean a huge shift in quality of life for patients, it also means a huge potential for cost savings as well. You see, the genes that cause Proteus syndrome and other overgrowth conditions are some of the main drivers of tumor growth. So the end of one family's diagnostic odyssey for a rare disorder could actually help to develop precision therapies for a condition that I'm sure everyone in this room has heard of, cancer. Because we have access to amazing resources at the NIH, we've been able to offer on a research basis one of the most extensive genetic tests available, whole exome and whole genome sequencing, to families of children with undiagnosed conditions since 2010. And through this study, we've been able to end the diagnostic odyssey for dozens of families. And I can tell you that as a clinician, there are few things more rewarding than sitting down across from a family and saying to them, we found the answer, we figured it out, let's talk about what it is and what it can mean for your child and for your family. So I'll just share two of these conversations that have been particularly memorable for me. One family came to our study because 4 of their children seemed to have a specific genetic condition that was already known, but no one could find the cause for it. They had a lot of genetic testing for this specific condition and some others as well, but all of this testing had come back negative. So we sequenced the family as part of our research study, and they remained invested with our group for several years because it took us that amount of time to interpret this genetic information. We actually collaborated with several groups from a lot of different countries to try to confirm our findings of what we thought was the genetic cause for their condition. Throughout this time, I again had the privilege of interacting with the family, and they told me many times that while the best news that they could hear from us was to know that we had been successful and that we'd figured out what was happening with their children, the fact that an international effort was being dedicated to trying to help diagnose their children was tremendously meaningful, and it made them feel that they were not alone in their journey. When we did eventually share our results with them, we were able to tell them about several other families in the country and across the world whose children shared their diagnosis. And they were overjoyed to know that one result of our effort was that clinicians in the future would know which test to order when they saw children presenting with this range of features. And this would help families in the future to get answers in months what this particular family had waited years for. Another family had one healthy child, but sadly they came to our research study after 2 of their children had been born with severe seizures that really never went away, and so these 2 little boys passed away when they were just months old. Their goals in participating in our research were, of course, to understand their own family situation, but they were also adamant that the potential to spare another family some of the pain that they had endured through an earlier genetic diagnosis was an incredibly important motivator for them. We got them an answer, and the gene that we found is now included in many epilepsy genetic panels, a fact that the family has told me they found extremely gratifying. There's another happy ending here too. The family used pre-implantation genetic diagnosis to have another healthy child, and I think of this family every year, at this time of year actually, when they send us a Christmas card that includes a picture of this adorable little girl. So not all genetic tests provide families with answers, and I can't share stories like the ones that I just did about everyone who's in our study or who has genetic testing. I've worked with and continue to work with families who are still very much on this journey, and they tell me that the uncertainty of what the destination will be, and in fact if their journey even has an end, is one of the most difficult aspects of this road. They tell me how difficult it is when every specialist they see asks them and would actually really love to have one unifying explanation for a disparate range of features, and how difficult it is to manage based on symptoms rather than experience with a number of other children with a diagnosis. They worry that they are missing some treatment or therapy because their child remains undiagnosed. And they're at a loss when when well-meaning family and friends ask them, what is actually wrong with him? Or the doctors still haven't figured out what's going on with her. How they as parents feel judged and inadequate when they themselves don't know how to go about getting the answers to these questions. So as I mentioned, the Diagnostic Odyssey is absolutely a clinical term that we use frequently, but I think that actually detracts from its importance and significance. If we think about the description from Homer, Odysseus was blown off course a number of times on his journey and suffered an enormous amount of challenges. And this is how it is for families who are on this road. And so if we think of genetic testing, for us, it really is, it can provide a chart to navigate these uncertain waters, and it's tremendously helpful for all of us in the field. Thank you.